Hi, I thought I'd bring you to a different place to talk about mental clarity. Where do you go for mental clarity? What is mental clarity? It's a big problem in the United States, probably worldwide, but I can only speak for the United States. And as I see it, there's three things that you need to do. We've already talked about one of them, which is being in mild ketosis. It is so important that in 2005 at Brown University, they discovered through a lot of hard work, and they coined the phrase Alzheimer's as being type 3 diabetes. Now, that's almost 20 years ago, so that's not all that recent. But what was interesting and what people don't know when they say Alzheimer's is type 3 diabetes, they could also say dementia is type 3 diabetes, but dementia is a larger category. And that is, there was nobody in the group that they were studying that had Alzheimer's that had type 1 or type 2 or prediabetes. It was in the head, so to say. It was strictly in the head that glucose was a problem. It was a problem kind of in reverse in the sense that they couldn't get enough. It had been high for so long, the insulin was high for so long, it forced the glucose down, and it closed a number of gateways, you say, 1 and 4 different receptors, who cares, right? But that's how long that expression has been out there. And what's amazing about that is that we all tend to think of prediabetes, diabetes, obesity as being the same thing, and then from there it gets worse. That's true. That's true. I mean, there's a cardiovascular, cerebrovascular problem that happens. But what is amazing here is that there was none of that, and yet there was a glucose insulin problem in the brain that was creating a hypoglycemic event, chronic hypoglycemic event. And from that discovery of, maybe it's a blood sugar problem we should be looking at. Well, from that, just a few years later, in 2008 at Colorado University, a researcher, I think his first name is Stephen, but his last name is Henderson, basically started using C8, caprylic acid triglyceride, MCT oil. And he got a patent on MCT oil. Don't know how that can be reinforceable, but he did the research to show that actually ketones were used by the brain. So that's now in 2008. So that's 14 years ago. So ketones started to come on the scene about 14 years ago. And then in the very distant background was a Dr. Veach, who has since passed away, was working on ketone esters, which has come about and it is a product out there. But the point I want to get to is not chasing a product. The point I want to get to is that mental clarity, reversing cognitive impairment as far as you can. If it's already gone too far, if there's too much atrophy of the brain, if it's advanced stages, there's not much you can do there. So it's the early stages of that, is that dropping down, and by the way, welcome to Eastern Carolina. There's an airport back there, and this is a sunny day, and they're all doing their practice takeoffs and landing, right? And there used to be a fisherman back there in the video. Let me pause for a second. So to continue, before I was aeronautically interrupted, that glucose is at the heart of a lot of disabilities, certainly cerebral disabilities, certainly mild cognitive impairment. And then there's Dr. Kinane's work up at Shorter University in Quebec that has showed that. But the interesting thing is cognitive impairment has now been documented to happen in the 20s. I'm sure you're probably getting to happen back in 10-year-olds and 15-year-olds, but it's happened at a time it's never happened that young before. And so looking at food source is the first thing, but also looking at staying away from carbs, certainly the processed carbs, is really the greater culprit. And it's not so much, oh, I had a snack there, I had a snack there. What do you do chronically? What do you do consistently? So when one is 60, looking back over 60 years, arguably 40 years of a pretty standard American diet, it's going to be harder to reverse some of that because they've been really drilling away at making it very difficult for them. So the three things you really need to think about in terms of cognitive impairment, and I'm going to be going further with that, and how to reverse all that is certainly the ketosis. That's important, mild ketosis. We're not talking about the classic ketogenic diet. You're also talking about omega-3s, Omega-3s in conjunction with B vitamins. I'll say B vitamins generally, but specifically I'm meaning folate, B12, B6, and I would throw in B2 as well. But there's a lot of research on those first 3 B vitamins, and the omega-3s have to be used together, because there is great thinking that, oh, well, omega-3 is really going to help with brain support. And so they did all these experiments and studies on omega-3s, DHA and EPA, and none of them really worked. There wasn't any, nothing came out. And then there was others about, well, wait a minute, it's folate and B12. They did that and not much happened. You have a fat soluble, you have a water soluble. But you put them together, very powerful, and has been documented starting in around 1910 and before. But Vitacog, out of Oxford University in the UK, put that together, and now they're on solid ground saying, you know, Alzheimer's is reversible, barring the fact that it's not too advanced. So that's pretty good. The third thing is really the area of neurotransmitters. Nootropics. Nootropics really at its core are all about choline. And I've talked a lot about choline, and I'm going to talk more about choline. But you look at a whole food source, which is egg yolks, for the most part, and you can get into liver. A lot of things have choline, but egg yolks are the number one. Wherever you are in the world, it's the number one. So that would be something to think of your diet in that way, just to give it what it needs. Some people need 100% to come in through the mouth, to be part of the diet. Others not so much, depending on their genes. Those are the 3 pieces we put together to achieve either, if you want to look at it as mental cognitive repair, creating mental clarity where there wasn't any, reversing dementia, or just mental clarity or peace of mind. It's a big, big deal. Hope you'll stay tuned. Just had to introduce you to Roxy. She's a local resident green slider turtle. She's a little shy right now, but she shows up. Here we go. She shows up daily for her meals. Clearly she's not cognitively impaired. She knows exactly when she's going to be fed. That happens about 10 o'clock each morning, right here in this little dock. Amazing. So she's a female. My guess is she's probably 20 to 30 years old. And she's the only turtle that's brave enough to come out. There's plenty of turtles here. This pond, by the way, is a good example of an analogy for making something work that it shouldn't generally. And so what do I mean by that is that this is an artificial, it's either a small lake or a big pond, and it's the remnants of an excavation site for taking sand to build local bridges here in the greater New Bern area. But so what do I mean by the analogy? It's like, well, you'd think that they just ripped this off. It used to be a pasture. Before that, it was farms. And even before that, I hear it was plantations back in the Civil War and before. And so now they have this artificial pond. Well, it's actually full of fish. It's full of turtles. Hasn't been any alligators yet, thank goodness. They are in this area, apparently. But it works. And so the analogy is this. Sometimes you have to be a little artificial to recreate a completely natural environment. And I speak that about mental clarity, about mild cognitive impairment, is that sometimes you need to reach out to do some supplementation as well as whole foods. As it is right now, there's nothing that needs to be supplemented here. This worked out just fine, and they went through stages of figuring out how to do it. It is now on self-run. I believe that's where our health is as well. Roxy's kind of a good example of that. Hope you enjoyed that. I just want to say, if this is something you're really interested in, as I am, you might be really interested in following some of these videos. Take care. Till next time.